Hi everyone, my name's Kate, and today I'm going to be walking you through question 7 from the most recent version of Free120. So starting with the last sentence, reading which of the following is the most likely diagnosis? So this is a 32-year-old man coming in with a 2-week history of fever and throat pain. He has a BMI of 21, which is on the lower side, respiratory rate, pulse, blood pressure, all within normal limits. Physical exam does show scattered lymph nodes. And there are bilateral tonsillar exudates, but no ulcerations. Hopefully you will have your lab value sheet and you can quickly compare and say, okay, hemoglobin is low, hematocrit is low, leukocyte count is low, and platelet count is low. So everything's low. Also, they tell us that a heterophile antibody test result is negative. So a heterophile antibody test is a test for mono. So the fact that that's negative means that this patient does not have mono. So we can go ahead and cross off Epstein-Barr virus, which is the most common cause of infectious mononucleosis. Um, Now, as far as the other answer choices, um, I think it's notable that the leukocyte count, or the T cells fighting off the infection, is low. And typically in bacterial infections, we'll see a leukocytosis where there's an elevated number of white blood cells fighting off a bacterial infection, but that's not happening in this case. So we can go ahead and cross off any bacterial causes. So gonococcal pharyngitis, LGB, which is I think chlamydia, we can cross that off. That's another bacteria. And then streptococcal pharyngitis, another bacterial cause. So that leaves us with the answer, HIV, which is the correct answer. And just reviewing the presentation of acute HIV shown here. Initial infection is asymptomatic, but eventually after exposure, they do develop these mononucleosis type syndrome. So anyone that you're concerned about mono for, you should also be concerned about acute HIV. Um, and it lists, some of the symptoms here that are shown in the vignette. Another common presentation is oral thrush in an HIV positive patient. They mentioned tonsillar exudates right here, but I'm not sure if that's what they're getting at or not. I don't think so. I think that was, again, more of a distractor to point you or make you think mono, even though the mono test was negative. Um, and then hopefully a refresher that, the acute phase, which is where our patient is in this problem, is going to have this drop in CD4 T cells, which we see with the decreased leukocyte count. But they're going to have this clinical latency period here where they'll remain relatively stable as their body and the T cells are trying to fight off the virus. But eventually they'll experience exhaustion, and that's where you'll have a rapid decline. So it's important to be able to identify acute HIV. Also, just a fun fact, all adults should be tested for HIV at one point during their adulthood. That's a USPTF guideline. Um, so something that we definitely don't think of as common as we probably should. And I think that's why they incorporated it as a guideline is, anytime you're experiencing a mononucleosis like process, HIV should be at the front of the mind. So if you have any questions, feel free to email me, let me know. Happy to help.